of local recording, and then the issue of allowing local recordings and making recordings available to the public. And I think we're all agreed and set up to do that.
Yes.
Okay, good. Thank you very much. The first order of business is a moment of silence in honor of the memory of our chair, Chris Cotters, who, as most of you know, passed away last month after a brave battle with a long illness. He was certainly a mentor to me over my many years in the blindness field, and he will certainly be missed. So, moment of silence, please. Thank you very much.
Thank you, Joe, very much for doing that. And I just wanted to take a moment also to just express how important Chris was, I think, to all of us. But I wanted to ask David if there was an update on your efforts with the legislature for a commemorative recognition.
Yeah, good question. We'd be pleased to do whichever the SAB wants to do, whether it be from the governor, from the legislature, and if it is from the legislature, which type? Do we want to do a citation? Do we want to adjourn, like ask one of either the House or the Senate to adjourn in his memory? That could be printed, and that's printed, and that's like, that's something you could do. So
Okay.
Really, which
I
direction?
thought you had initiated something, but if not, we can take it up after, offline and figure out an appropriate commemoration.
Okay.
Chris.
We'd be pleased to do it. Just I don't know what the board's preference is, we'll do whichever you guys want.
All right.
I'm more than happy to defer to your knowledge. It's a little more, you have a little more experience in that area than I think I do. So
yeah,
we can arrange for those details, offline. That would be great. Thank you.
So we'll do something. I mean,
thanks.
Yeah, sure. Go ahead, Joe. Sorry.
All right, good. Next order of business is the election of the chair of the SAB. Is there a motion?
Mr. Chair or Mr.
Yes.
Acting Chair?
Yes.
I'd like to acknowledge and thank you for stepping in after the loss of Chris, and I would be very proud to nominate you as the next chair of the SAB.
Second.
All agreed.
Aye. Okay.
Aye, for sure. Thank you, Joe.
Aye, for sure. Thank you. You're welcome. The next order of business is vote to accept the July 30th, 2021 minutes. I had marked.
Congratulations, Joe.
Thank you, David.
We whipped that through so quick,
I had thought that I did mark up the July minutes. I don't think any other member of the SAB did. And I managed, I think, to send to Trish a markup the June minutes. So that was a mix up on my part. I'll get Trish a revised July and we can vote on those at the October meeting if that is acceptable to all.
That's fine.
Good.
All right, thank you. And I apologize. And as usual, welcome to any members of the public attending the meeting. What we'd like to do is to get through the agenda and carve out the last part of the meeting, 15 minutes or so for questions and comments and so forth. David, do we have an update from the CFO on MCB financial results FY22 through August?
So I had sent you the latest dashboard. We could go over that if you'd like.
Yeah, that one came in. I haven't reviewed it yet because it came in this morning.
I didn't either, so I think a review with David would be good.
Okay.
Yeah.
Regina, can you allow me to share my screen?
You should be all set.
Okay. All right. So what we have up here on the screen is the latest numbers that we have And in the first column, it lists the budget line item number. The next column, it lists a description of what each line item is. The next column is a comparison, like it's a look back. So this is fiscal year 20 GAA. So that's the accepted budget. The next column D is House 2, is the FY21 House 2 budget. The next column is the FY revised House 2 budget. The next column is the FY21 GAA with the overrides. So that's really the finalized budget. That's really the one that goes to the comprehensive annual financial report. That's the quote unquote settled books.
Yeah.
And then, so now comparative to those, that's like the history. Starting with G, you have the year-to-date expenditures. And the year-to-date, obviously we're young in the year. Oh, go ahead, Jeff, sorry.
So it's, just to be clear, that's FY22.
Yes.
And then kind of a side question is, I know all the way on the right, we'll talk about this. You have the FY22 guide. Does the commission have a budgeted spend by month internally, so that maybe when you do this report in the future, you can show year-to-date expenditures actual, and then year-to-date expenditures budget. So in other words, if you're comparing August to August budget versus August GA versus August actual, just so we can see the direction of things. That would be helpful.
I will ask the lawyers and the financial people to see if we can give that out. I think we may be able to, but I'm not sure. We can put that request in. I think one of the things here is, even in a very typical year, when we submit our maintenance budget, like that's the exercise we just went through, and for the public that's listening in, the maintenance budget exercise is basically a plan that we submit to the Executive Office of Health and Human Services, who then works with administration and finance. And that's basically like how you're going to spend your money by not only by account, but even like a little bit more granular that by program.
Mm-hmm.
So that generally, and again, the reason why I refer to the lawyers and the CFO and the financial people is generally that's not public information. That's executive policy discussions, because it's fluid. Because I think what happens is if people were to get those numbers, they would think like they would have expectations, number one. Number two, that may violate some of what we're doing with contracting and vendors and bidding and things like that. So just to be clear, I don't want anybody to think we're being evasive or anything. That isn't the goal. So I'll try to find out what we can share, and we will share it. That's why the answer we've gotten previously is anybody who would like to know, any member of the public can go to See-Through, and See-Through is the Commonwealth's tool that the Office of the Comptroller uses for all state spending, for every agency, for every account. So I hope that answers the question.
And so we'll pick it up for the November meeting, and we'll, the tutorial on See-Through just that I got sent me to See-Through without the tutorial on how to use it. So we still have to teach me how to use it, because I can't, other than looking at line by line, which is payment by payment, which is too granular for me. There must be a way of summarizing it so I can make some sense of it. But I sent you an email, and we can talk about that offline.
Yes.
All right, next subject, and this is for Susan and Mary, I believe, if Miss Mary is on the phone. MCB review of FY22 through August dashboards for tracking MCB performance. And I'll turn this over to Susan and Mary if she's on.
Thank you, Joe. I don't think Mary's able to make it today, but she sent a document, Trish. I think you have it.
Yes, uh, she sent, the reason I sent it to you was there was one error in it I had to correct after I spoke with her this morning. And and Judy, I think Judy Savageau is on the phone. The only reason I didn't send it to you, Judy, is I didn't have your email.
Oh, okay. We can follow up afterwards. I'll send you that. Thank you.
Thank you.
Is it possible, Trish, that you can share your screen and show what Mary put together?
I
Trish, you
shall.
could- Trish, if you want, email it to me and I'll do it.
That'd be great, David. I will do
Yeah,
that.
email it to me and I'll share my screen.
Just take me a second. I am Zoom novice.
Take your time. And just for everybody, not to get too personal here, but Mary is out on she's had a death in the family, so she's.
Oh, I'm sorry to hear that.
Sorry to hear that.
And the alternate.
So it's not a casual reason she's not missing.
Right.
I've emailed that to you, David. The
Okay, I
email
got
has
it.
the
I got
Excel
it.
attachment.
Goodbye.
Yeah, and I'll do my
Goodbye.
best to summarize it as I'm seeing it afresh with everyone. Just to give an overview, Mary was putting together and working with me and Judy to try to get down to some indicators of just case flow. So what's happening, or is demand going up or down, and starting with registrations right through to closures, and then the difference between children, adults, and people using social rehab services and people using VR. So this is fresh off the press, and I think we're viewing it all for the first time. But Mary presented on it at an early phase of it last meeting. So David, if you want to go through it,
Sure.
or if you would prefer, I would either.
Yes, no, that's fine. We're in touch with this all the time. So, but for many of you, this may be the first time you're viewing it. I think what we've seen as a result of COVID is we're actually very pleased that this number is as high as it is, to tell you the truth, because the first 3 or 4 months of COVID, there was zero movement. Like, I mean, there was like, you couldn't even go see people even if you wanted to. So literally, like there was nothing but I want to be very appropriate about this, the way we talk about our consumers, because I love our consumers. I obviously have very high esteem for our consumers, but there is a natural flow of how people come into our agency. And unfortunately, as life cycles work, unfortunately, there are people who leave the system as well. So when you're not bringing in new registrants, new consumers, really you're just losing consumers. And again, I don't want to get too particular, but every day unfortunately we lose consumers. And so when months go by, quarters go by, like what happened during COVID, and there's really none being added and only ones being lost, we were very surprised and encouraged that this number is as high as it is. This 1,000, just for everybody's edification, maybe if you can't see the screen, I'll describe it. So in 2019, we registered approximately 1,860 new consumers with MCB. So what is that? That is their eye doctor sending us a mandatory report of legal blindness into our central registry. And then we begin the process of getting in touch with those consumers and availing them and letting them know the programs and services that are available to them. And a large amount of them were able to start giving programs and services right away, and some we aren't. But in either event, they're now on our registry. They now qualify for all of the programs and services we have. And then once a year, we do a major check with the Social Security office, and quarterly we do additional checks, and then monthly we're doing checks with the Registry of Motor Vehicles. Let me explain all what I just said. So again, with people who are quote unquote leaving the system, unfortunately, passing away, or moving out of state, or some even having a new diagnosis and their vision changes and they're not legally blind anymore. With the Registry of Motor Vehicles, we're doing that monthly, because obviously we don't want our consumers who are legally blind driving. They shouldn't have a valid mass driver's license. So we check our list with the RMV to do that. Quarterly, we do a comparison within the data that we have within state government to, they call it, unfortunately, it sounds morbid, but it's called the death match. We do that. And then once a year, we do a major one that we bring in another index as well. So that's some of the tools we use here. So while we think these are accurate, these are really just a snapshot. I just want to make sure everybody's aware of that, that these are, like, as of today, that number might be slightly different. And as of next week, it will still be even slightly different. All right, so that's the big kind of long explanation.
David, if I could interject, just
Yes,
what
sure,
these
Susan.
numbers are showing is that in 2019, you had approximately 155 new registrants per month. And it went up and down per month, I'm sure.
If you average it out, yeah, here, I'll go, yeah.
And in 2020, you had about 88 per month. And now in 2021, so far, you are averaging about 107 per month, but there has been an uptick in July and August to about 140 per month. So you
Yes.
are seeing a slight increase in demand, but still not greater than what you were doing in 2019.
No, right. And we're actually projecting an even bigger increase when our ad campaign hits more fully. So we backloaded the What's Your Vision campaign that people may have heard on the radio. It's been in newspapers, it's on television, it's on the web. So we backloaded that. So most of that is going to hit towards the end of September. So we think that as a result of that, there'll be a lag, and then we'll probably get more after that. And hopefully with COVID, things are opening up a little bit more. I think that's what you see with the numbers that you were just talking about month to month, Susan, is the more we've kind of opened up, the more people go to their eye doctor and get visits and things like that.
If there's anything that you could do on intake, or do you have anything planned on intake of whether the person heard about MCB through What's Your Vision campaign? Are you doing any kind of a assessment of that? Because that would be good if you do see a spike, if you can link it back to your campaign.
Yes. So when our short form goes into effect, Trish, remind me, we do have at least one question about how did you hear about MCB, I think, or something like that. But that's a good idea, Susan. We could actually add, like, specifically like a campaign to the answer list. Like if it is What Your Vision or something, we could add that.
Yeah, because that would be excellent data to have to evaluate that effort. And so if you start to get above 155 a month, you are getting back to pre-pandemic numbers. But so I guess to summarize, demand is increasing. It's not increasing over your 2019, but it's getting close. And with the What's Your Vision campaign, it could exceed it.
Yes.
So you may have a lot of demand on your counselors by January.
We're anticipating that, actually. Yes.
So I had a quick question or comment.
Yes, Joe.
That the What's Your Vision's paid for with federal dollars.
Yes.
And clearly there's a halo effect on consumers that are not federal.
Yes, and that's allowed.
It is allowed.
Yes.
Okay. That's interesting. Okay.
Yeah, no, RSA is clear that it's not a zero-sum game. although the primary purpose does need to be vocational, and I think that's what the ad achieves. I mean, it's all about, you know, if you want to work, if you're a consumer and you want to work, if you're an employer and you want to hire our consumers.
Yeah, and another interesting factoid that Mary was trying to create was, are there people that come in requesting non-work related services that then end up, after learning a little bit more about what's possible, move over to voc rehab?
Yeah.
And so she's gonna try to track that, because they may have come in the doorway not confident about employment, and then after some services decide that they do want to get employed. So I think the approach is taking a no wrong door approach.
Yeah, we think that to be true anecdotally, and we've wondered how to be able to measure that.
Yeah, and I know, I don't think we've resolved it, but Mary and I had a conversation about that she was going to be playing with some ideas of how to look at cases that move in between those two two kind of lines.
Yeah, I mean, one of the reasons why I think Massachusetts does such a good job, and that's not to demean any other states, but you're going to see when RSA releases the data, we're going to be one of the only states that shows gains. Many of the other states are losses or treading water. We're showing gains. So, and one of the reasons I think is because we have such good wraparound SR services as well. So even if you're a VR consumer, you're getting those SR services. You're getting orientation and mobility. You're getting assistive technology. You're getting adjustment to blindness and all of the other things it takes to be employed and employable. Yes, it's about work skills and job skills and all that stuff, but it's also about all of the other aspects of life and then just being prepared to work as well. So I think that's one of the successes that we bring. I mean, as you know, we're one of the few states that provides state money for people with blindness. Most states rely, if not solely, largely on their federal dollars that they get, either through the VR program or the Older Independent Blind Grant, or maybe some elder services monies, or, you know, they piece it together.
Well, I know the RSA 2021 data is not quite out yet, so we'll see what happens. But are you comparing yourself to other blind agencies, or all general and combined and blind agencies?
No, yeah, that's a good thing too, because as you know, or people on the Zoom here who may not know, so out of the 50 states, all 50 states receive vocational rehabilitation dollars that we're talking, Susan and I are talking about here. Of that, though, about half of the states have a general agency, meaning there's only one vocational rehabilitation agency for the entire state for all of the disability prevalence types. There's 25.
Yeah.
There's 25 states that have a blindness agency and then a general VR agency. Excuse me, we're one of them. So I think it's most appropriate to compare ourselves to those 25 states because they have separate blindness agencies. You know what I mean? So, but I mean, if you slice and dice that 9/11 data, the RSA data, you know, in some states, even though they're not a breakout state and they're a combined agency, they're pretty large. Like look at California or Texas as examples of that. So.
Yeah. I think the story is the VR agencies are doing the best they can during a pandemic, and so we'll see a recovery. But then Mary also wanted to look at both open cases, closed cases.
Yep.
So these next indicators she was playing with.
And that's what we have here. So we have it broken down: children, adults, and deaf-blind extended supports. And we give you the snapshot there and the percentage change. So we're basically looking at, we don't have a lot of data here because it's only a short period of time. But I mean, I think you can see that counselors going back on the road has led to an increase. That's the takeaway here. So things opening back up from COVID means more activity.
Yep. And then it looks like you're having most of your increase with adults rather than children, which makes sense as the schools are just reopening now.
Yes. Yes, and additionally, one of the things we're now starting to find out more that we have the AIM library within MCB is we're definitely going to pick up more children once we get our arms around the confidentiality of the data. So like right now, we can't really look at children who are below, Lauren, is it 12? Lauren, you there?
Yeah,
You're-
I had to unmute.
Oh,
So
yeah.
we're in a situation there where we have to also figure out how to write these releases and notices to the parents, because I believe at this point we only get names, and we get names of
Right.
legally blind children, and we do not get any other contact information.
But for my point, Susan, and the rest of it is, we believe there are children who are getting services through AIM that are not on our central registry.
Mhm.
So how can we appropriately approach those families and say, hey, if you're legally blind, we can give you additional programs and services here. So we're
Right,
figuring out
it's-
ways to be appropriate there.
Right, it's pre-ets as well, and it would be unusual for a child to be in pre-ets if they're 12, but those things happen. Or that the child can be VR. So at 12, unusual, but it's possible. So
One of the things you might want to track then is on your what's your vision campaign, is if you are noticing families coming in with a child under 12.
Yeah. Yeah. And so I don't know if Carla is here, and I don't want to jump around too much because I think you probably want to talk about you mentioned the money we got. One of the aims that we have for a significant part of that money is I don't want to say continuation of what's your vision, but maybe enhancement's a better word. Is Carla here?
I'm here. Hello,
Hi.
how are you?
Carla, now I know we can't say too much because we're going to have to RFR it and everything else, but maybe you can give the group here just like a little bit of an understanding of what we're hoping to do, part 2.
Right. So it's kind of a continuation of the campaign branding and the premise of the campaign to encourage employment outcomes for consumers and also for employers. But it will be more of an offline component and TBD kind of what that will include. That will depend on what we put together and some of the recommendations from the proposals that we receive from different bidders. But we do have an idea of it's more of outreach materials, direct outreach materials that complement that campaign. Yes, and don't want to say too much because I know that's part of the bid process.
Thank you. Joe, I don't want to take up too much time in this agenda item. Do we have a little bit more time to go through the rest of the data?
Yeah, I think, yes, I think it's important data.
Okay.
Yeah,
Okay,
and please,
so-
if it could be also emailed to the rest of the SAB, that would be helpful.
Sure.
I think
So-
I did email it to the rest of the SAB, but I was a day late and $1 short. It was 11:59.
Oh,
We'll be sure to do it.
no problem. Thanks, Trish.
Yeah,
So
we
you saw the
understand.
open SR cases, and next is open
Yeah.
VR cases. Again, the fact that we have seen increases there to me is a testament to our people. And when I mean our people, I mean the consumers seeking jobs and the counselors helping them navigate towards those jobs. So this is the fact that we're showing gains, I think is remarkable during the COVID environment. when the first 6 months, the first 3 months, it was record job losses, and you know what I mean? So
Yeah, and I think you've seen about 40, an increase in pre-eds youth at 40 over the summer. So likely it'll increase during the academic school year. And just sort of, it's hard to keep up with, knowing, I think, Joe, your original question about is going to be an excessive demand. It's hard to understand that over the summer for youth data. I guess we will see in the next 2 months or so what happens with the pre-eds numbers.
Yeah.
okay, and then closed cases. Trish, do you want to give them what we do to determine closed? I'm putting closed in air quotes.
Yes. With adults, in the SR program and with children, each child or adult in the SR program has a goal, to be more independent in the community, to have appropriate institutionalization, which is rare. Almost all of them are to be more independent in the community. And the services are planned to reach that goal. When that goal has been reached in SR, the case is closed. Typically, say for a senior who's blind, it might be some orientation, mobility, rehabilitation, teaching, and low vision aids. And when all that is provided and the consumer agrees that they are more independent, the case is closed. So we closed in 2019 almost 2,400 cases, and in 2020 about 2,100 cases. In our year to date, the calendar year, which is only 6 months, we've closed 970, which probably keeps us on track more with 2020 than 2019, because most of the clients in the program are senior citizens. And as you know, senior citizens in Massachusetts remain very wary of COVID and are not participating to the extent they did before.
So a question on the SR cases. And it's really two perspectives, and I'd like to get into this a little bit later, but wouldn't we expect that for the earmark for the assistive technology, software equipment, supportive technology, training, so on and so forth, that 850,000 will result in more cases being opened? I would think. I would think. I would think. And then the fact that your budget, non-earmarked budget, went up about another $800,000 on top of that. When your counselors look at somebody that they've determined has reached their goals, a lot of that, of course, has to do with the amount of resources that you have, correct?
Yes.
So you're constrained. So would there be an expectation that with this additional money, both for the assistive technology and then in general, that you'll be able to open more cases and maybe keep them open a little bit longer?
Perhaps that will be a case-by-case determination that will be made by the counselor and the consumer. Will we make the goals maybe a little bit loftier, maybe a little bit more, because now we have resources to do it? Yeah, maybe. And additionally, I just think that if you look at the demography of the Commonwealth, we are facing more consumers, whether we like it or not, if that makes any sense, because we know that as people get older, they age into blindness. That's the number one way people come to us, is by aging into blindness. And the Commonwealth on a whole, average age is going up. Just like in New England, it's going up. So I think there'll be more opportunities just by those numbers.
And that might be something that Mary, if we look at this dashboard, we can look at reasons for closure a little bit more closely down the line, because there's probably a lot of different reasons, particularly for adults, that people close out.
So while we're on this subject, this is more of a budgetary thing. But I think it surrounds openings and closings on the state side. That you've got this, you're going to have more people, whether it's the result of what's your vision or just because more people are being declared legally blind because they didn't do it last year because they weren't going to the doctor.
Right.
Okay, so we're going to have an influx. We've got this earmark that I know you have your RFRs out, and I'm going to ask you about your plans there. And then you have this additional 850,000. Do you have the resources? I mean, I don't know where this 850,000 is. I don't know if that's subcontracted services. I don't know if you hire more people. If you could comment on that, because it seems you've got financial resources and probably an increase in demand,
Right.
both with respect to doing stuff proactively and both with respect to COVID subsiding. Do you have a plan for spending this money and for being able to serve these folks? Do you sit, in your management meetings and talk about what happens if?
Yes. Yeah. So I wouldn't say plan. I would say plans, because we have a lot of different scenarios. If this happens, then we'll do this. If this, you know what I mean? So, what I will say is I've made clear to all of the executive team and all of the managers, I want to make sure that the large majority of the additional dollars that we got go as directly to the consumers as it can. Okay. Now, with that said, there's some things we need to be able to help everybody at the same time. We know we need a better phone system, for example. We've heard that from consumers. We've heard it from staff. That's a procurement that we're going to do. Those don't come cheap, especially the one that we're going to get, which we hope will be voice activated, really easy to use and have good, interface and everything else. That's probably, again, until we put out the RFR and actually get quotes and things like that, that could be maybe it's 50 grand, maybe it's 250 grand. We won't know that until we get that. So there's some of that in there that we have to factor in as well. But
I mean, probably that's fair. I think that it would be good at future SAB meetings that as it becomes more clear about how many cases, how many registrations, how many cases, what people need, the human resources you have to provide the services, and then you offset that on a phone system. And I hope that'd be something you have it as a monthly discussion with the SAB, because I know things are going to change.
Yeah. Yeah. Again, staying within all the constraints of state bidding and contracting. We're going to update. We'll update everybody, because really, you're going to be involved, and everybody on this call will be involved, because we're not just going to make a purchase without talking to the community. I really want to go out and have listening sessions on, if we get a phone system, what features do you want? Because here's what we heard. Before we decommissioned our nuance system, that was the voice-driven system. I cannot tell you, when Regina is here, how many complaints did we get, Regina? We were getting so many complaints about that system. So then we go to a more traditional push-button system, and you get complaints about, well, where's that? You know what I mean? So we want to try to get a system that's going to try to serve the largest amount of people the best it can. Is it going to be perfect? Probably not, but we'll try our best. Yeah. So we need to hear from our community on what features they want.
Amy, do you have something you want to weigh in on?
Yeah, I guess one of the things that I've been thinking a lot about is, with the influx of the monies that need to be spent by June 30th, because it's kind of a, it's a one-time allotment. And if we anticipate, as I do as well, that we're going to have an increase and influx of new registrants and new requests to reopen cases on the part of current registered consumers whose cases are not yet open. Have you thought about, and if you can share them, what your thoughts are about how we make sure that the caseloads don't get so high that there is a significant delay between the time that person finds out they have a new client and the time that the client's needs are met? Because that's a tall order.
Yeah. We do think that will be within manageable levels, because particularly remember the way that we give most of our services. Yes, there's a primary counselor, but there's also like a lot of what we do is the cafeteria style. So yes, you'll come in, you'll get your adjustment to blindness, but then you're also going to get assistive technology. You're also going to get orientation and mobility. So yeah, there's one counselor kind of coordinating that, but you're working with all different parts of the agency, which
right. But the counselor's the gatekeeper, correct?
Yeah, for the most part, but we think it'll be manageable enough.
Okay.
We're aware of that, but we feel confident because, I mean, we're almost at full employment. We're going out with another posting. I'm asking to add 2 FTEs, so it's not like we're down a ton of counselors or something.
Okay. Well, I appreciate that, and I would be very interested in having ongoing information about that.
Yeah, and here's a comparison. Joe, you brought up technology. It's a more tangible example, right? Because with the technology, we can say, well, we're going to spend X amount on hardware. And that hardware, what is it? It's magnifier, desktop magnifiers, handheld magnifiers, lenses, Alexa devices, like things like that we can get a decent price on, that we know about, you know what I mean? And then some of that we say, okay, we're going to send to the Carroll Center for this training, or we're going to put this many more people into the Vibrant program or whatever other pilot we may do, So when it comes to like the technology, I feel more confident of being able to give you more detail. It's with some of these other things that it's a little bit more challenging, because particularly when they involve RFRs, until we start getting quotes, we won't know what it is.
Right.
You know what I mean?
But on the particularly on the earmark, and I agree that's pretty well defined in what you can and cannot spend money on.
Yeah.
Do you have a plan? I know you have RFRs on, but do you have a plan on how you're going to approach your consumers on this? Like, which consumers are eligible?
Yeah.
Are you letting consumers know? Are the counselors being tasked with, you got to come up with 5 people or whatever, so that I would, other than the people on this call, including the public, in general, the consumers don't know there's $850,000 out there that will help improve their lives. And it really depended on the counselors, right? To identify these people and so forth.
Since I've been commissioner, and even really as long as I can remember, and institutional people in the agency knowing, there's been very few instances where MCB has not been able to provide something, or has outright refused or something. That really is rare. We're always able to put something together. Now, and here's the allusion I would make, a metaphor that I would use here. We've always been able to give people, let's use a car. We've always been able to give people a car. Now, when times are tough, we've been giving them a Pinto or a Ford, a Toyota Corolla, like an entry-level thing, or a used car or something. It will still get you to a place, but it's, it might be not shiny or whatever. Now we have the money to be able to give out a brand new, I'm not gonna say Cadillac, because we don't have that much money, but like a new Camry or something like that.
Yeah.
Right.
And the question is, what are the plans to make it known to your consumers, or for your counselors to identify those consumers that really need
yeah. So the plans are to really work our tried and true, what we've been doing. And let me define that. So that's working with the counselors to let them know that the resources are available, so that maybe they can cajole the people a little more. Hey, try this, try that. Particularly with technology, we have so many seniors that they just don't want the technology. But once we can finally get them to try it, you can't pry it out of their hands, okay? So there's that aspect. The other is to work our networks, our existing relationships. We have a great relationship. We communicate all the time with the Carroll Center and with MAB and with all of our partners to let them know, hey, we have capacity. So if you come across leads, send them to us. People are interested. So there's that. And then additionally, what we've been doing with What's Your Vision, trying to get more people in the eye care community. You know, we've spent a lot of time with eye doctors, letting them know that we have additional resources now, and it's probably in your patient's best interest to be declared legally blind. A lot of people are hesitant to do that. So I think we've done a good job of working with the eye care community, and I don't want to say they're selling people or convincing people but I think we see more registrations as a result of that, particularly during COVID. I mean, I think that's what you're seeing with these numbers. If you look at other agencies, I think their numbers are off more than ours are.
Right.
Go ahead, Joe.
I was going to say, you go first, and then we can wrap this up. I was going to suggest that I listened in on some of the RC call the other day, and that the amount of successful closures resulting in jobs, I guess, is quite impressive.
Yes.
We don't have to talk about it now, but it would be good in October to have that as a little drill down by John or somebody on the success, where the jobs came from.
Well, October is
so
National Disability Employment Awareness Month.
Yeah, that would be good. I guess
Yeah.
what I wanted to just do is to summarize it, because there is an increasing incoming, so there is some demand, and it may also kick up more with the What's Your Vision campaign. The data is also suggesting that there's a decrease in closures, particularly in SR. The number of people that are leaving or closing out is lower per month than prior years. So you're going to end up potentially with a higher caseload, so I wonder if there's a tipping point for you of caseload size by counselor, and
Yes.
when you might want to advocate for more counselors or
Yeah.
some other resource.
Yeah.
The second thing I wanted to say is your VR case rehabilitation numbers look really very good, and it's great to see that 152 number not even in a full year. So I guess one question is the closures out of VR as well might help you figure out, do you need more SR counselors? Do you need more VR counselors? And where with the What's Your Vision campaign, are they coming into SR? Are they coming into VR, or both? But I do have a bit of a concern, given these numbers, that counselors are going to see their caseload sizes increase. And what's your plan to monitor caseloads? What is an average caseload, or what's a suitable caseload size, do you think? And then what's a tipping point for you to advocate for more staff?
Okay, there's a lot to unpack there, so let me try my best. So let's start with our agreement that we have with our primary union for the counselors, which is SEIU 509. In that agreement, there is an addendum at the end. In that addendum, it indicates what the maximum amount of consumers there can be per counselor in the agreement. I want to say, if Camilla was here, she could tell us exactly. Trish, you may remember. I want to say it's like 188 or something, or 182. For some reason, that number's sticking in my head. But I want to say we average per counselor somewhere around like 120. Some counselors may.
That's way high, David.
Yeah.
What's that?
I think that's way high. I'm sorry to interrupt, but
The addendum number?
I don't know.
I thought the addendum indicated, Lauren, do you remember? I thought it indicated like 180 or something was the max. Anyways, what I was going to say is there's a range amongst the counselors, right? So even though there might be an average, I don't know if that average is totally.
Maybe we're talking apples and oranges. Maybe that's cumulative in a year. I think and Mary can correct me if I'm wrong, but I think at any one time, anything over 75 would be very unusual.
Yeah.
Yeah, and also just to add on, this is Mary, by the way, and so there is a difference between an open case. We have some open cases that you are actively receiving services where you're going to see the consumer and such. But then we also have some active cases where you actually just call the consumer once, actually twice a year, for daylight savings time to change their clock. And so some folks usually keep them on their caseload. So they keep carrying them. You can have at least 10, 15, 20 just on your caseload. So that's not, so is that a real caseload? So they're all these different variations in caseload.
Yeah, no, I think that's really the good point is, Susan, are you interested in open?
Yeah, I'm interested in trying to figure out.
Through, because as we indicated, many counselors will see a significant amount of people added and then a significant amount of people leaving in a year. That's the number I'm using, is that total large amount there. You know what I mean? Not just ones that they're servicing every day or every week.
Yeah, I mean, I think there is a difference between what's an active case and, you know, what's the intensity of the case. But given this dashboard, there does seem like there's a high potential for an increase in incoming, and your investment in the what's your vision campaign makes it even more likely. And there is a decrease in closures in SR in particular. And so what's your plan? I'm not asking necessarily for specifics, but what's your plan to where, you know, there's red flags that the caseload sizes are going up, or
when the counselors let us know.
So you're relying on counselors to tell you, is there any sort of data that you're tracking on caseload size?
Oh yeah, the regional director and the supervisor are very in touch with that. I mean, look, the easiest math to do is to take this number right here, the 3672, and divide it by the number of available counselors.
Mm-hmm.
Now, one of the things though that gets challenging there is, what are we using for the amount of counselors? Are we using the assistive technology people and the orientation and mobility people, and you know, or are we just using the actual counselors themselves?
Yeah.
That's what I'm saying. That's what's in the addendum, and that's what I was referring to with these larger numbers.
Yeah,
it's just that simple math.
Yeah, this is Amy. I guess that leads back to my concern about delays due to increased caseloads, because I'm thinking specifically of counselors, because you have to have an open case with a counselor to get those other services.
So
yeah,
David, may I chime in?
Yes,
just to explain the SRDBES, which is included in the 33672. Those are consumers who are forever with us. The only reason they get closed is when they pass away. So, and we have a dedicated staff for the DBES. So if you really want to look at the current caseload, is the children, you know, the movement is when they either pass away, they are medical involved, or they move into VR for VR services when they turn 14. So the SR adults part there that's the part where you want to look really for caseload distribution.
Well, and the other piece too that should probably, if we're going to do these dashboards all the time, one of the things that we should have here is the breakdown of you know, a TVI, an O&M specialist, an assistive technology specialist, you know, all of the people who are either capital C counselors or small C counselors, depending upon how you look at it. Because I mean, I like to think we're servicing all 25,000 people in some way. We just sent out 25,000 certificates of blindness. Now, so if you do that math and divide it, well, then it's hundreds of people per counselor. You know what I mean?
Well, Joe, if I could make a recommendation that maybe
yes, please.
Myself, Mary, Judy, others that are working on these dashboard numbers, maybe contemplate how we might capture caseload size and make some recommendations next time. And I know it's complicated and there's a lot of nuances to it, but I just wanted to say, I'm finding this dashboard information really, really helpful, concrete, and want to thank Mary for putting it together.
Good. And we'll just continue the discussion. We'll have that as an agenda item, as a drill down for the next meeting. So David, why don't, we fell behind a little bit, but I think the conversation was absolutely worth it. On the commissioner's update, when you take a look at the actual FY21 GA and then what didn't get spent, there's an amount left over. How much is left over? How much of that is eligible for future use? How much of that goes back to A&F?
Yeah, good question. So because of the circumstances around COVID, A&F did something that they usually don't do. They've done it before, but they usually don't do, and that is to let money carry forward. That was I forget the exact amount, but it's basically like that's the additional $850. So that's encouraging because obviously we have more resources. So,
all right. So the additional, so if you take the 26,552,000 final GA,
yes,
and then you subtract out what you spent.
Yes.
You subtract out $850,000 that got rolled into the FY22 budget, which I wasn't aware of. So that solves that mystery. How much money did not get spent?
The exact reversion amount, I'm not sure. I can get that. Let me see if I can text Chandra that right now, and I could probably get it. It's not as much as you would think. I thought I maybe even gave you an estimate at some point.
You said a couple of $100,000.
Yeah, but let me see if I can get that exact number.
All right. And I'm just gonna, as you're texting, or I'll go over the next item. For the $850,000 earmark, David, was there any sort of consumer input in structuring the programs? Is this something the commission is doing, or is this something that you're talking to some of your consumers?
This is which now? The technology line item?
The technology line item.
Well, my understanding was, remember, we're the executive branch, so we support the governor's budget recommendation. So anything that happens in the legislative process, we'll give technical information, but many of the advocacy groups, that's up to them to provide advocacy. As they did, obviously, because there was a significant amount of money that the legislature appropriated.
Yeah, but do you solicit input from the consumer groups about how to structure the program, not how to spend the money?
I would say, to tell you the truth, we haven't had to solicit. They've solicited us.
Okay.
They've approached us with various proposals and things like that, and we're working through how to appropriately have the process work, meaning RFRs and, some with existing, like the Carroll Center, that's we have a technology contract going with them anyways. So that's kind of an easy one. But other programs have proposed us pilots or expansions. And I think the thing that we have to mindfully work through is, if it is a new program, that's supposed to be RFR'd and, that's supposed to go out to public bid and everything else. So some of it can go existing if it's not a new program, but if it is new, it probably has to be RFR'd.
So, and that leads to this question. I know you have RFRs out there. And those are scheduled, I guess, to be closed sometime during September, hopefully. Have you spent any of the $850 yet? Are there vendors providing services?
Yeah, I think we have started to spend some of it. And I think it's with the tried and true, right, John? I think it's probably with the Carroll Center and maybe MAB.
No, the 850, the earmark 850 has not been spent. It's not.
No. I think he's talking about technology contracts in general.
The technology contract we have is for training. In our contract, we don't have any any current training contract to allow SR folks to get training other than through the OIB grant.
All right, so we're now 3 months into the year, have 850,000 to spend and haven't spent it.
The 850,000 is in the RFR that's on the street now, Joe, and is being
Right.
finally released today. So the money is not even in our budget to be spent yet. We have no purchase orders written against that, or have we spent any services towards that 850?
Yeah.
Okay, and then spend, and the RFRs are going out today, you said?
The final version is being released today, and it's due to be submitted on the 17th, if memory serves me right. And then we'll evaluate it. I think by the 24th, we'll have.
That's the goal.
We'll
That's
start
the
making
goal.
awards, yeah.
All right, good. So we've talked about the adequacy of resources to meet expected increased demand for services. That's an ongoing discussion. With respect to the rent savings, I know you hired a budget director, David. Have we figured out what the rent savings for New Bedford and Worcester was?
When you say figured out, I mean, so we realized part of that money in the previous fiscal year, and we realized the remainder of it in this fiscal year. Because we have plenty of resources, like it's not an issue now. We didn't know that then, obviously, but now, now as a result, I still think it's a good move, because now, particularly that we've gone with hybrid work. So the amounts are absorbed. And I mean,
what were the amounts? On an annualized basis, what were
I thought it was like 400, but we only realized part of that one year. I want to say it was like 150 or something in this fiscal year.
All right. All right.
All of them.
Okay. Anything else on the financial end that the SAB would like to weigh in on?
No, I'm all set, Joe.
I'm set.
Okay. All right. So communication challenges and solutions. I know, and David, you alluded to it. That it's been an ongoing challenge on registration, reaching counselors by phone. I know you're talking about a new phone system. Any update on that?
Yeah, so we're going to be doing requirements gathering. And in that, as I indicated, we're going to go out to our stakeholders, our consumers and our groups and partners and try to find out what they want out of a phone system. One of the things we've done, which I think is a good thing, but it leads to some challenges, we've expanded significantly the amount of ways you can get in touch with MCB. And so for many consumers, they're pleased by that, but some, it confuses them or it's overwhelming to them or whatever. So, it used to be that you really only had 1 or 2 ways of getting in touch with MCB. It was either the phone or by mail. Well, now it's the phone in like 5 different ways. You can call the 1-800 number. You can call your counselor directly. You can call central registry directly. You can call, all the different departments directly now. Additionally, everybody has a cell phone, so you can call their cell phone number, right?
Yep.
You can go into our virtual blindness registry online. There's all the social media channels that we have. So we haven't taken anything away. We've added all these things. So that's good because now people have more options. It's challenging though, because now that's more stuff to check. It's more, it's more to coordinate and everything else. So I think what we're looking for out of a new system is something that will help us coordinate all that a little bit better and automate that a little bit better.
Yeah, David, this is Amy. One thing, and I don't know whether you've looked at systems like this, but I know a lot of companies, like my bank does this, for example. They have, when you call in, there is an option to use either speech or touch tone input. So at the very outset, the person calling in can make that selection.
Right.
And I would think that, we've we went from one to the other, and I would think that to satisfy the most consumers, it would probably be best to implement a system where either would be usable and selectable by the consumer.
Yeah, I tend to agree. And again, we're going to be proactive in our efforts to hear from as many consumers to find out if that's what they want also, which I think that probably is, but I don't want to just guess.
Right.
I'd rather get a good hearing from the consumers across the spectrum, because I think one of the challenges with us is we notice that a lot of the more recent consumers who tend to be in school still and tend to be VR, they very much like the technology. Matter of fact, more than like it, like they require it, like they demand it, like they don't want these other systems. Whereas some of the people who maybe are more experienced and have, relied on more traditional technologies, they don't like that. So how do you serve everybody in the way they want it? You know what I mean? That's the inherent challenge here.
David, this is Kim.
Commissioner, oh, go ahead, Kim.
Yes, hi, Kim.
Hi. I just wanted to say that for the Perkins Library, I'm going through the exact same challenge that you're going through with the phone system acquisition. So I've been starting to obtain, feedback and input, and I'd be very happy to share my input if you would like to share your input, so we can do the best for our consumer community.
Okay, yeah, I'm interested. I mean, if you've got leads on phone system, or Amy, even tell us what bank you use. Like,
I use Bank of America.
Press or say one. That's the phrase they use. Press or say one.
Yeah. Yeah, I use Bank of America, and it will say, when you come on, it will say, right now you're using our speech-enabled system. To use our touchtone system, press star or whatever. They're not the only people that do it.
Definitely not.
I would also recommend that perhaps you have a focus group. You organize a focus group with a diversity, particularly if you're talking about the phone system, specifically with people who want to use the phone system. Because you're right, a lot of people don't use that.
Commissioner, and Joe, I do wonder if there is funds available to put out an RFR to get an entity who's very sophisticated in these kinds of modernization of communication systems in public entities, that you can get support, because there's a lot of strategery here that's needed. It's how are you going to build this for the future where the 12-year-olds are going to be happy when they're 25, and how do you not leave anybody behind? So is there a possibility of getting in some kind of RFR or contractor who can advise maybe MCB plus the Carroll Center plus Perkins plus the blind community on how to modernize? Or is there something just for MCB?
That's a good point. That's a good point.
I don't know if that's allowable under state contracting rules. We can look into that. What I will tell you is, right now, the first RFR we're doing, which should be ready soon, is to get a professional to advise us on our options and how best to do it.
That's great.
Because we don't have, we can't take so much time on this because we got to spend all these dollars.
Right.
You know what I mean? So if we're going to go and survey everybody and everything else, that all takes time. We need to have this done and complete and the last check written by June 30th. So, we're moving quickly here.
Yeah,
So
I just wonder that there are entities out there that are very sophisticated in this that could advise.
Isn't that what David just said, that hiring a consultant to help define things?
Yes, I'm agreeing with him. I think that's a great idea.
Yeah, I think that is a good idea. Next point, David, I know that there was a little bit of confusion and concern with some of the COVID-19 protocols. Do you ask consumers? Do you ask staff? Have they been vaccinated? Masking policies and so forth. I know the governor has come out with some new regulations, and I know that you were discussing things with the with the union. Where do you stand right now on the protocols?
Yeah, so as of October 17th, all state employees are going to have to show proof of vaccination. That is going to be a term of employment, I guess you're calling it or something. So that guidance has started coming out. We got an email today from the Human Resources Division around that. We're following that. I tend to think for our agency, we're going to be in a good place. I think most of our people are vaccinated anyways, but we'll work through whatever issues there are. We'll have a dialogue with the union and whatever employees there are, because there are some exemptions as well. There's exemptions for medical and there's exemptions for religious. So we'll respect those and we'll work through those as they come. There is a process put in place by the Human Resources Division. And that is what it is. With regards to the other requirements, City of Boston has put in place these masking requirements. We're observing those in our Boston office. And then we're just, the situation remains fluid. So we do our best to try to stay updated. I've designated Camilla Dragos, our human resources liaison. She sits on she's the MCB captain to get the updates for all of the human resource interactions going on with COVID. So she gets those. She got married, so she's been away the past couple of weeks, but when she comes back, we'll get more updates. So I think we're in a good place there in compliance wise, like with our workers. With the consumers, I think most of the consumers that we've come across, there's a high rate of vaccination there. There are still some that aren't. And I think we try to outline the advantages as best we can to them appropriately. And we'll continue to do that. So
I understand that there was concern on the part of the union on asking consumers whether they've been vaccinated or not. Don't know about the masking requirements, but is there a requirement that consumers be vaccinated? Is there an obligation on a counselor not comfortable going into someone's home that hasn't been vaccinated to not perform the service?
Yeah, what I would say is I don't want to turn people away, right? If people need programs and services, then let's problem solve a way to get them. We showed all throughout COVID that there's ways to do that. Do we want to do it in person? Yes, but we're only going to do it in person when it's safe for our workers, safe for the consumer.
So
John, do you have anything to add? Oh, I'm sorry, go ahead.
Would the consumer then have to be vaccinated in order to? No, but again, that might change the manner with which they're getting their services. That's what I mean. Meaning getting an in-home service versus virtual.
Yes. John, do you want to add here?
So right now, the way we deal with those, Joe, if someone hadn't been vaccinated and we would do what we could to try to get them to meet us outside or meet in an open area. But a lot of our folks, or some of our folks are not concerned. They would wear a mask and they would practice distance as much as they could inside if it was an essential service that had to be done. We've had hesitancy on some of consumers wanting to see anyone. So they've continued virtually on the phone with those cases. So it's sort of going to be almost on a case-by-case basis, how comfortable the counselor feels and how comfortable the consumer feels, and are there other people in their home? If they live with a bunch of other individuals, then or family, then that may be consideration if someone hasn't been vaccinated. But I think most of our counselors are saying that they feel comfortable that they can maintain the social distance. They can use all of our staff have face masks, and so they're prepared to do the best they can to try to avoid it. But I know a lot of the folks have even have just said, "Oh, we'll meet outside." I know employment services folks, a lot of them have come out and met with their consumers out on their porch, or on their deck, or near somewhere near their house, if they did not feel like they wanted them inside. So we're being as flexible as we can, and consumers are being, cautious in some cases, but many of them are receiving in-person visits and continue with virtual.
And importantly, that the commission and the union are seem to be aligned.
I think at this point, I think that we've come to an understanding. Yes.
Yeah.
And that services are staff, they're union members, so staff are indeed seeing folks. So obviously things are working okay.
So I do have an update from Chandra regarding that reversion amount for, if you're interested.
Yeah, please.
Okay, so for technology, it's less than I thought. I thought it might be as high as like 400. It's not. It's 90 for technology, the reversion amount. The total for the agency was, was that big number that we had talked about. But it's, it's a little deceptive because like half of it is from deaf-blind extended supports. So
yeah, and some of it, Joe, is purchase orders that we allocate the money and all of a sudden, like college students, we've had some folks drop out.
Right.
So that tuition gets kicked back, but we don't. That doesn't.
But that's federal money, right?
Yeah, it's federal money. You're right. And say like camperships, some camps that were supposed to happen and some didn't. We had a Perkins program that was canceled in July. That kicked back some money there. So, and some DBS consumers were involved in that. So that's a lot of those reversions on the state side hard to avoid because we find out so late that the person's drop is not going to use the money or the program is not running at capacity, and then the funds can't be moved anywhere else.
All right. So I understand. Is there a number that you get through everything? Some of it, I guess, is stuff that just happens anyway. And is there a number on what got reverted?
David would have that number. I don't.
David, do you have a number on what got reverted?
Sorry, I just had a coughing fit.
Oh.
So I'm sorry, say it again.
So overall number on what is getting has been or is reverted to the state.
Yeah, has been reverted. I mean, it's all the closures. So I think it was, let me scroll back. I mean, it was a big number. So there was 2.6 million just from deaf-blind extended supports. And then there was about another 2.65 throughout the rest of the agency. That includes the 90 for technology.
Yeah. Okay.
So, but I mean, remember, that's all driven by being closed for.
Understood. That's understood.
Or effectively closed. We weren't closed, but effectively we were closed. The whole state was closed.
All right. So update from the July meeting. There were 3 areas we were talking about. We've kind of talked a little bit about We Are Vision, but would like an update on some of the measurable outcomes.
What's your vision? Yes, Carla, are you here? We have what's your
vision?
Right. We have great news to report here from our partners that we've collaborated with here, our vendors, Marketing Doctor. So Carla, do you have some stuff to share here?
I do, and I know we touched on it a little bit. The campaign is still running. We do look at a monthly dashboard with Marketing Doctor, and we have an executive summary of all of the results of the campaign to date. And we do that every month with them so that we can pivot accordingly if we need to for the digital platforms. Like LinkedIn was not performing well one month, and we adapted the ads to be more video targeted. And lo and behold, in July, LinkedIn was the biggest driver to our website. So we do have those reports every month since the campaign started in May. And once the campaign, it formally wraps up in accordance with the RSA funds on September the 30th, but the placements will actually run through October for the campaign for National Disability Employment Awareness Month. And they will highlight different things that we're doing during that month.
So if you could share at the next SAB meeting, some of the dashboards that you're using to measure LinkedIn, Facebook, Instagram, and so in how Marketing Doctor and you are measuring success or not in terms of website hits, email addresses, direct inquiries. If you could do that, that'd be great.
Absolutely. I can definitely share those monthly reports with you. And just like some of kind of just the overall, we're trying to actually correlate some of the data with our VR registrations. And I know that Trish mentioned this earlier and Mary too, but we saw a 13%, which is not, that big because those are small numbers of VR registrants in July. But we'll take that as a win. We think, that's due to a number of things, not only what's your vision, but kind of the return post-COVID, but, we'll take it. And hopefully that we will be on that upward trend towards the end of the year too. But we're also seeing higher engagement on other platforms that we are also tracking. So on our social media platforms, we have 450 followers on Twitter now, 456 on Facebook, 405 on Instagram. That's a new platform since 2020, and 344 on LinkedIn. So we do have engagement metrics that we pull every month on those platforms also. We have 41 new phone opt-ins, and those are individuals who will join us via phone for our town hall events, via Teletown Hall, which is that new platform to extend reach. We're also seeing an increase in the number of people who are opting in for our email notifications. We've had 64 individuals sign up since May, when we started to push that a little heavier. And we have 233 who have signed up over time since 2020. We had our third email newsletter went out. Consistent open rates there are at 34%. That's higher than the 17% click-through and open rate benchmark for email newsletters. So we'll take that as a win too. Not all of that can be attributed to what's your vision, again, because we're doing so many communications channels and running so many outreach tactics. But we've definitely seen an increase. And I think the biggest thing to report is that in July, we are tracking website visitors. And we had 11,410 sessions in July. And this is exciting. We had 8,380 new users in July. So those are people who had not visited our website previously. And a lot of those, again, in July were driven from LinkedIn and from the ads that we placed for What's Your Vision. So very, very exciting. Overall for MCB, I think we'll see a lot of that hopefully by the end of the year reflected in our numbers, in our registration numbers, and also in people receiving VR services. But some of that will take some time, I think, to see the results of. So we'll hopefully be able to continue that What's Your Vision branding in a number of different ways in 2022.
Did Marketing Doctor work with the commission to come up with targeted likes and likes, visits, and click-throughs? Is there a target
for which channel, Joe? Because
each channel.
They helped us with placement of the ads. They were actually our media buyer, but we talked with them through the strategy of our audiences and who we wanted to target for the campaign before we selected those channels for those ads. They really served as our media buyer because they have those established relationships already.
And that's what the RFR with them was for. They did give us some other, they built value, but Carla and I have discussed that. And I think we've, to tell you the truth, met or exceeded what we had hoped to do. I mean, these channels started from nothing.
Yeah, they have been a really great partner for us. They do have those established relationships with traditional outlets and also digital channels. So we got a lot of what they call bonus weight when we bought those ads, and that has helped us for you guys to report back and tell us about the many times that you have been surprised or to hear or see the ads in rotation.
All right, thank you. I'm sorry, go ahead, Susan.
Yeah, it's great to hear, and thank you for all the numbers. So if I'm understanding, the funding ends September, you're gonna go through October because of disability awareness, and then you've got another RFR coming out that might do something else and extend your marketing efforts. Is that correct?
Yes, that's correct, Susan.
That's our hope.
Yeah,
All right.
it's great to hear. Sounds very successful.
Well, I think RSA was very pleased. And so when we heard their reaction, I think it was natural that, well, let's just, put in for that again.
This is Kim, and I just wanted to say, I think the numbers are really impressive. I know we started from a low benchmark, but I still think that this kind of marketing and outreach is really, really great. And I do not know of very many other agencies around the country that have done this kind of a marketing campaign. And, I see it on the evening news. It's pretty visible in a lot of places. So I think your ad buyer is well worth what you're paying for them, because you certainly are getting a lot of exposure. And, I don't know that it, transfers over, but I was impressed to hear John's report at the stakeholders meeting about a 25% increase in placements.
Yeah.
For clients.
And then additionally, John, do you want to indicate the 6-figure placements that we've gotten?
Yeah, there's been a few. I don't have them in my, there's been a few that were pretty high, over 100,000. There was quite a bit that were between the 70 and 90 something thousand. So they're quality, and a lot of them are in the 50, 60, 70 range. So they're quality placements. It's a lot of them are not the entry level type jobs that were around. A lot of our graduates are getting good placements. A lot of the folks coming through the internship program, a lot of the folks going through Employment Now with Carroll Center and Polis have been getting good placements. And we've had some surprises. Some students that we found, some consumers we found, obtained the job when they'd been unemployed for quite a while. So
that's great.
And I would just ask
that's why the
everybody to
25%
consider-
came up from the previous year in some of those cases.
And I would just ask everybody to consider where we've come from.
Yeah.
Just how many years ago, John, were we doing homemakers?
Yep.
Back in 2015 and 16, we used to do 100 homemakers a year, and those are totally gone.
So it's a credit to John. It's a credit to all the counselors. It's a credit to all of the consumers.
So when is that's really terrific. When is the job fair, guys?
That's October 1st.
All right, so it would be good. I don't know, John, if you were on, but we volunteered you to give a kind of a drill down report on the good numbers for the placements, and maybe some specifics, and you could roll into that results of the job fair. I think that would be really good.
So
and talk a little bit about the training that people received, and what the skill sets were, and so forth.
All right, I'll have to go through with Trish and pull all those reports out and the salaries and everything. But that's quite a. So the job fair will not have immediate results. Maybe we have one or two.
Yeah, I was just going to say one or two.
That's a slow process, and it's just a lot of relationship building and introducing the consumers to employers. We're
getting
doing
them an interview.
We changed the format this year where we have the consumers who are job ready, which is about looks like around 30 right now, that are going to be coming and doing a pitch for the employers that are sitting there and listening to the pitch. And then those employers who find that person might fit or be of interest to them, then they'll schedule an interview later for more exploration on employment opportunities. But so this job fair is going to be a little different. It's going to be more pitch, let the employers know who's out here, and then the employers will select who they'd like to continue and explore more with.
But you'll have some feedback, I'm sure.
Sure.
So, I mean, that's terrific news. Update on the feasibility study to establish a for-profit business.
Yeah, so I had met with Kevin Lynch from the National Industries of the Blind. He worked up a, I guess you'd call it a concept paper that is, I just got it yesterday. I haven't even been able to talk to John about it, but it's really around two of our things. One of them is the for-profit business enterprise, but another one was the e-commerce. So it kind of integrates both of them. Basically, their proposal is to work with us to get some consumers to start this e-commerce business as a business enterprise. So again, when we were talking about the budget, this could be something that, I don't know, is it 50 or is it 100? We don't know. Depending, I think that will depending upon if we can get the right profile of person that fits and is entrepreneurial and has the skills and is ready to do it. Do we stand that up? So that's good. You know, John's done this a couple of times before, and we're going to explore it.
So a question for you, and I'm a little bit rusty on this. That a lot of the companies, most of them nonprofit that are NIB affiliated, are not eligible for federal VR training funds because they're not considered integrated work.
Yes.
Is, you know, to the extent you're starting to do anything, would you be able to use federal money to invest in this, or would it have to be state money?
No, it would most likely be federal money. Nearly all of it would probably be VR money. And Massachusetts is not going to partake in any sub-minimum wage of any kind.
And I'm just going to be clear that the issue is not sub-minimum wage. The issue is competitive integrated employment settings, right? That was the issue. It has been the issue.
Right. We're not going to engage in that. Anything we do is going to be it's going to exceed any expectation. Trust me. Go ahead, John. Sorry.
It's going towards more the self-employment side, Joe, and having someone incorporate a business or start something.
Okay.
That's
someone or someones. Ideally, what we do is we'd get 2 or 3 of our consumers blind, maybe 1 fully, 2 partial, something like that, and maybe. And I'm saying maybe, throw in another couple of people. Maybe they're blind, maybe there are other disabilities, maybe they're not, maybe they're typical. But put some type of group together and incubate that as an e-commerce kind of small business enterprise. That's what we're kicking around and seeing if we can pull off.
Okay, look forward to updates. And I think this one is more in Susan's bailiwick. The comprehensive state needs assessment.
Yes.
Any update on that?
Susan, are you saying anything?
Are you muted, Susan? We're not hearing you.
No,
There you are.
I'm just listening. I think what we were looking for was an update from the commission on what they're doing about the comprehensive state needs assessment findings. It wasn't my thought that I would be summarizing it.
Mary still
No. You on that one, you had more knowledge and can ask the question better than me.
I'm here.
Mary, yes. Do we have an update on that? I don't have an update, to tell you the truth.
Well, I think the best update we have is we met with the SRC last week, I believe, or last week. And one of the things that came out of that was we have a SAB committee that's going to really work on the VR state plan, and they are going to work with us together to figure out how we can implement or initialize some of the recommendations. So
that occurred while I was away on vacation, by the way. I was away for 2 weeks.
Yes. So
that's why I know nothing about it.
So for right now, we don't have anything to report because the group hasn't met yet, but I think for the next meeting, we'll be able to give you some information.
Thank you, Mary. This is Susan. I mean, there's a lot of goals that were in the comprehensive state needs assessment that are long-term in nature, not just something you're going to change immediately, but there are some good goals about things like increasing access for people who are rural, who live in rural areas, or increasing services to racial and ethnic minorities. Are all those recommendations within what you're tasking SRC or that subcommittee to be thinking about?
Exactly. And in fact, one of the wonderful things about the reaching out to the rural communities is COVID, sorry to use that, but COVID really had us looking at virtual gatherings and doing things virtually. So for especially our pre-eds, they have really benefited from that a lot. And then the reach for What's Your Vision? I just happened to be in Springfield, and there was a lot of information that got from the What's Your Vision. It was in the paper. I got 2 papers, it was in all of them, and I also listened to it on the radio. And so we are going to look to see what has happened, if there's anything that's coming in from those regions, to see if there's the uptick is coming from there, because that's one of our underrepresented and served communities.
That's great to hear. I think one of the things that would be interesting in the new RFR for marketing and whatever happens in the future is how that aligns out with what the comprehensive state needs assessment said were underserved communities. So if there's some way to, you probably already have, but if there's some way to connect those dots between that would be great. And it sounds like you're seeing that starting to happen.
Yeah, and I think the other thing is, so we have the gateway cities. We have the Worcester, the Brockton, and in Lawrence, etc. And what happens is, it's not just it's minority, but it's also cultural. So we're also looking into that and seeing if we can bring some trainings to our counselors so that they can meet the consumers where they are around there. So there are a lot of little things happening around the comprehensive statewide needs assessment that I think with the help of the RC, we should be able to come up with a better way, a less fragmented way of how we implement it or how things are going.
Right.
All right. Is there anything else before we turn it over to questions from the public? Anything else that the SAB would like to discuss?
I just have 2 quick questions for John, just as a follow-up. Congratulations on the employment outcomes that you're getting. Are you anticipating, one, that you might see increased program income? And 2, any of those jobs, are you seeing people take remote worker or work from home jobs?
So actually, just last week, Thursday, I had a meeting with our employment team with United Healthcare and the MRC team also. And they've offered us 15 positions to work from home 40 hours a week with a starting pay of $16 to $18 an hour. And if you're bilingual, you get $1 more to start than the numbers I just mentioned. So therefore, we've already identified 3 individuals and have referred them to the company for interviewing. Joe and Carol are going to meet another couple next week. And MRC is also identifying individuals and setting them over for interviews. So
that's terrific.
There have been some other homes, but this was a big cluster of home opportunities. So we've moved on that. But other than that, there has been a few home opportunities that have materialized. What was the rest of the question, Susan? Sorry.
Do you expect to see some increases in program income because of your 25% increase in placements, or is that something that may turn into revenue for you?
Oh, you're talking about the placements that we made about reimbursement? Yeah, sure. Yeah, I mean there'll be. I don't know if we have a lot of funding. I don't know if it's going to result in it's going to result in more reimbursements coming in down the line.
Yeah.
But as far as program goes, we're always looking for different ideas and new ways to do things. So, but it's, I mean, we have plenty of funding to continue our Employment Now initiative. We have exploring some other ideas. We have plenty of funds to, offer. We're also talking with MITRE. They're looking for us to find a statistics major who is blind. And I have found someone who's a math major that they they're prepared to offer an internship and place them in, it's a paid internship actually, of $1,500 a week. So we're working on that. We've only identified one individual that we'll refer to them to speak with if that individual is interested in doing that type of internship.
Yeah. Well, congratulations, John.
Mhm.
That's great news.
Yeah, and we just participated in a virtual job fair that the state held, and we had our staff there. So we had a booth there, and we had some of our consumers apply for positions around the state. Also, we're meeting with the diversity committee. Our employment team is handling this. We'll bring in 2 consumers, I think it's every month or every couple of weeks, so that they can interview them as mock interviews to see if there's any opportunities that they fit into. So that's something new that's came out of the diversity fair that we participated in a few months ago. The relationship has continued, and our employment services team is working to bring individuals to that meeting so that hiring managers and other folks who are on that committee at least get exposed to them and may offer an opportunity down the road.
All right, very good.
So no other questions. No other questions for me.
Okay.
All right, thank you. So turning it over to the public, if anybody would like to ask a question, just raise your hand on the chat and we'll monitor it on this end. I know we have a question from Debbie. Debbie, go ahead.
Hi, yeah, thank you for having me. I had a question because I've been trying to get that certificate of blindness, and I know the commissioner just mentioned that 25,000 have gone out, but I didn't get it on the mail out. I went to the website and applied or did whatever I was supposed to do to request it, and I called, and I haven't had any luck with any of that. So I don't know, maybe you could just advise me where to go next, or
yeah, I'm sorry you didn't get one. I don't know why. And you know,
right.
Mary's here. Mary, can we get Debbie one?
Yeah, so Debbie, I just want to apologize because when we send out the 24,000, we used our mailroom distribution. The problem is we did not know that we were in queue. Other agencies also use the mailroom. So we really have been sending out a bunch for people who haven't received it. And then we have people who are receiving them a second time. But for now, if you send me your email, I can email it to you right now, or I'll put it in the mail today as well.
okay, great. So what is your email?
All right. So you're registered with us. Let me just get you there in the system.
Maybe you could look me up because I'm registered.
Exactly.
Every last thing that you guys have there. So I would think.
Yeah, I was just gonna say, maybe we don't want to do that in a public meeting. Give out Debbie's information.
Yes, I'll look you up and then I'll email it to you. If you have an email address, or it will go out in the mail today.
Yeah.
I'll put it in the mail today myself.
Okay, thank you so much.
Debbie, just to be, it's Macaulay, right? M-A-C?
MACAULAY.
Yes, thank you.
Thank you.
Yes.
All right, next question is from Sandra Burgess, or comment.
Sandra,
Hi, Sandra, you're on.
Might be muted. Exactly.
go.
You're muted.
Okay, hi. Can you hear me?
Yes, Sandra, hi.
Okay, hi. I'm very pleased with the results on those that are looking for employment, seeking employment. That's great. I wish the campaign, What's Your Vision, had been on years ago when I was young and looking for employment. I'm not looking for it now. However, I have a concern. Anytime that I hear that ad, it's focused toward employment. And while that's fine, and you may be getting people that contact you who are not in the employment arena that need assistance. However, I'm especially concerned with seniors because I know there are so many older folks that begin to lose their eyesight that need your services, and I don't want them to be left out. I don't know if there's a way you have thought of reaching out to seniors. And I have a question about AIM. There was some program, evidently AIM, that was mentioned earlier. I don't know what that is.
Sure. So the first thing Yeah, thank you. Good question, Sandra. So the first thing is related to the manner with which we funded the ads. The ads are funded through our vocational reallotment money. So the monies that we get from the federal government, from RSA, the Rehabilitation Services Administration, can only be used for vocational rehabilitation purposes. So we can't use those for a program or service that we offer that is not specifically geared towards employment.
Okay.
So that's why I think you see the focus where it is on vocational rehabilitation. Have we contemplated a separate campaign at our seniors? Yes, but it's probably going to be a different style of campaign, more of a direct marketing campaign, not a broadcast media campaign, because our state dollars are are more precious, quite frankly. There's less of them, and we really use those to try to go across like a wider amount of consumers, if you will, because I don't want to say that we have plenty of VR dollars, but we have enough VR dollars to be able to fulfill all of the vocational rehabilitation requests we have, pretty much, right, John? I think you could say that like confidently.
And we carry over some. So yes, we have more than enough to carry out vocational
and
stuff.
We carry over funds. With the social rehabilitation dollars, though, that's state funding that we get that has to be spread across a more consumers, and it's less of a pot of money too. So that's, we use that to try to be as direct with consumer support as we can, as opposed to like spending it on a larger advertising campaign or something. Not that isn't effective, but if it comes down to, are we providing in-home services, or are we sending somebody to the Carroll Center, or are we spending that money on an ad in the Globe? I'm picking the in-home services in the Carroll Center, 99 times out of 100. So we're just trying to prioritize the money to be as directly benefiting the consumer, the SR consumers, as we can. So the AIM library, AIM is an acronym for the Accessible Instructional Materials. Kim, did I get it right? I think I did. Accessible Instructional Materials.
I was about to help you and you did it right.
Thank you,
So that's good.
Which is a program provided by Congress through the American Printing House for the Blind. And it basically is getting large print and braille educational materials, primarily books, textbooks, and things like that for students. So that program previously was with the Carroll Center. It's an RFR that the Department of Education, the Department of Elementary and Secondary Education, had put out. And for many years, it was with the Carroll Center. Something changed, that they wanted to work a deal with MCB to do it. They approached us, DESE approached us and said, hey, would you think about, because years ago, evidently, it was with MCB, like decades ago, it did sit with MCB. So it sat with MCB, then it went to the Carroll Center, now it's back at MCB. And so we've taken that program internally to the MCB. We've made 2 of the people state employees and 2 of the people contractors. We actually added staff there as a contractor. We added additional contractors. So I hope, does that answer your question, Sandra?
That does. That's a wonderful answer to it. I just hope that whatever happens for seniors can be something that has some audio content to
well,
it.
we have more dollars this year. So I think the seniors are going to be pleased. I think we're going to be able to get to more of them with more programs and services, and strengthen the existing community connections we have, maybe even do some new things, certainly more assistive technology. So I think if you're a senior seeking services, things are going to be good for you this coming year.
Good. And I also have one last thought that just popped into my head. I think I have a good feeling that if you were to want to do outreach with seniors and you contacted the people in the 2 big consumer groups of and for the blind, that they would give you some input, give you some help.
Yes, thank you. Yeah,
You're welcome. Thank you for that. Thank you for the answer.
Yes.
All right, we have two more questions in queue. Greg Donnelly, your hand is raised.
Hi, thanks everybody. Hello there.
Good afternoon.
Good afternoon. Great information today. Great questions and subject matter. I have a question on the earmark. If, once everything's said and done and POs are issued, et cetera, if you go beyond the POs, say we get to April and we're beyond the original PO number, first of all, is there going to be like we don't have to do POs per consumer, correct? Can you do
Greg, that's discussion. These are things that, because the RFR is active.
Oh, we can't answer.
If you look on the website, the answer to that question, or to a lot of the questions that were asked are on there, and we really can't discuss that now because all the vendors are not here, and we can't discuss it unless it's a public forum for all the vendors, for all the applicants.
Got it.
John, Max has gotten to you, I can tell.
No, that's
Max is our contract person.
I don't want to overstep the bounds.
If you look on ComBuys, you'll see the answers to a lot of questions.
Gotcha. So, my main point is, there's lots of consumers ready to be lined up, and yes, a big challenge to spend down that $850 over, 3 quarters versus 4, but I think together we can do it. So thanks, everybody.
Thank
you, Greg. Next question.
For your collaboration.
There's not a name, but it's 508. It's a 508 area code on the phone. And you have to unmute yourself.
Good afternoon. This is Jane Perry calling from Falmouth. How is everybody today? Hello. First of all, I want to thank you for finally listening to my concerns and about other concerns down here on the Cape that faces the senior population or the older population. I belong to some other groups. One has to do with my vision impairment and also a syndrome of my vision impairment. And it's amazing how many people don't know about who could qualify for that program, the OIB program. And yes, Massachusetts has a lot of services, even though I know the commissioner and the assistant commissioner, deputy commissioner, and this group and the RC group, here's a lot of concerns. I call them concerns. You call them complaints. Try to be a little positive. But in retrospect, we should be very thankful about the services and about how things have improved, even despite the pandemic. So I do have some ideas, and I hope people will call me back or get in touch with us. Sight loss services down here on the Cape, they have at least 10 different support groups, and we have started up for the season. So I hope that Karen can come back. Karen Hatcher does a wonderful job.
Yes, we're looking forward to getting
information for a new director. Please don't ask me her name because I'm having a senior moment. But my 2 questions is, when is the town hall going to be happening in October? And I've heard a little rumor that the Commission for the Blind is going to be accepting people for services that have low vision. Is that true?
So the first one, Carla, are you there? I think is it October 7th from noon to 1:30, Carla? Did I remember that correctly?
Yes, Commissioner, you are correct. It's October the 7th.
October 7th, noon to 1:30. If you'd like to sign up, there's a number of ways to sign up. You can call us and opt in to our teletown hall, where all you have to do is answer the phone and you're immediately put into the meeting. Or you can sign up on the website, or you can let your counselor know. So that's the virtual town hall. And we're going to be talking, the focus this month's virtual town hall is transportation related. So we have people from the MBTA who will be talking about the ride and the Charlie card and all kinds of things. So it'll be a good one. Regarding low vision. So we've been working with the eye care community very well to let them know that our statute allows for a doctor to make a medical determination of what they view the progression of vision loss to be. And if the doctor deems that that vision loss will ultimately lead to legal blindness, then we can start servicing those people in some capacity. Now, there's some caveats there, and I don't necessarily want to get into the weeds on it, but we're trying our best. We're trying our best to service as many people as possible.
Well, thank you. It's music to my heart that you are trying to do these things.
Yes.
And I hope there will be information sent to the Site Law Services Director. I will get that number to you so that we can be more in the loop down here. You know, I'm a strong advocate for older people. And we seem to get lost, but I'm thrilled to hear about transportation for the next one because that's my baby. And I hope we can be working on the accessible, seamless, all Commonwealth transportation pass. There is
we're working on that, Jay. Yeah.
I know that, and I hope you keep me in the loop because.
Well, no, that's a great question. Why don't you, Carly, can we consider that a submitted question from Jane about the regional acceptance of the blind cards? That's a great question from Jane from the Cape.
That's a great question, Jane. We will submit that question to the MBTA. And I also just put in the chat, that is one of the things that the MBTA is willing to do is answer our community questions prior to the meeting. They would like those questions in advance if possible. You can submit them online. We have an accessible form at mass.gov/MCB. You can also submit those questions via email to mcbinfo@mass.gov. You can call our 1-800 number, leave a message with your question. That's 1-800-392-6450, or submit your questions via your MCB counselor, and they will pass those along.
Okay, because I think we need to get more of the other RTAs involved, just not the MBTA.
Yeah, we're trying, Jane.
Yeah.
There's a Cape Cod RTA advisory board meeting, and I hope to bring that question up because I have been asking for this since 2007 when I was the disabled non-voting member. So it's something that needs to be addressed. So thank you for your time, and thank you to this wonderful committee. I've learned so much, and every time I chime in, I learn something new. So thank you very much. You all have a wonderful day. Bye-bye.
You too, Jane. And with that, for the SAB, I entertain a motion to adjourn.
Motion. Second.
All right, so moved, and we will see everybody on October 8th.
Thank you.
Take
Thanks,
care.
everybody.
Bye-bye.
Have a great day. Have a great weekend.